Hello everyone, I am Dr. Parul Katiyar. I am a fertility specialist and I am currently the senior IVF specialist and the co-medical director at ART Fertility Clinics, New Delhi, India. I have been in this field of infertility management for almost 15 years now, and I have taken trainings at not only very good facilities in India, but have also been trained in the US as well as in Brazil. I have also completed my masters in human reproduction from University of Valencia, Spain. My journey to Ethiopia, or my travel to Ethiopia, started in the year 2016 when I came here for the first time to conduct an OPD for infertile patients in Addis Ababa, and since then I have been coming regularly. There was a small break during COVID times when travels were restricted, and currently I come to Ethiopia almost once every 3 months. In the management of infertility, there is a huge role of good clinical practice, and India is one of the very good leading countries for medical management of infertility. And therefore, when I come here, I get to see a lot of patients with infertility, and I am able to help them in the diagnosis of their problems as well as guide them as to whatever is the best clinical treatment available for them. I have also been involved in conducting CMEs with the Ethiopian doctors to impart to them the latest scientific development in the management of infertility. So far, my journey to Ethiopia has been very productive. I have seen hundreds of patients suffering from infertility, and a lot of patients have benefited from the treatment advice that I have provided to them, as well as a lot of patients who wanted and could manage to travel to India have traveled to India and taken treatment to overcome infertility and have been blessed with children and have been able to overcome their infertility and complete their desire for parenthood. In most of the cases that I see here, I see infertility as a very long-standing problem, and I also see that this is one of the most neglected aspects in the population here. So people or couples continue to suffer from infertility for a very, very long time, and they are still not aware of the entire range of treatments that they can undertake to overcome the problem. So my understanding for this problem in Ethiopia is that we need to conduct more awareness programs with regards to infertility, identify and recognize it as a disease, and also ensure that people or couples suffering from infertility get timely advice and the best possible treatment available, because this treatment is linked to one's age, especially the female's reproductive age. So if we continue to neglect it, many a times by the time women seek help, it is too late and they have probably bypassed or already crossed their reproductive prime, and for them then overcoming infertility becomes more and more challenging. I am very happy and I feel privileged to be associated with Wholemedicare company. It is a group that helps in organizing OPDs and medical treatments to patients from all across the world. It is a very organized company, and they provide very good support to the patients who want to undertake any treatment and which is currently not available in Ethiopia, and they facilitate and help them in traveling to India to overcome their problems. So therefore, it has been very important that this association between us, the ART Fertility Clinics, and Wholemedicare has been very rewarding, and it has improved the outreach for me as a doctor in the entire country of Ethiopia. To conclude, I would say that I feel very happy coming to Ethiopia to conduct these infertility OPDs and camps. By doing this, I feel that I am able to not only see patients but also help a lot of patients, and I'm able to help a socially neglected field here, and I would love to continue coming to Ethiopia to impart my advice and my knowledge to the people here.